You're watching TVC Breakfast. Well, the federal government has been asked to make it mandatory for Nigerians to contribute to the National Health Insurance Scheme to ensure that health care gets to all and the country isn't left behind in the United Nations vision of universal health coverage by the year 2030.
Now, our health correspondent Jacqueline Ogo has reactions to the implementation of the scheme in this report.
The United Nations has a big vision. It is to ensure that everyone has access to good health care across the world by the year 2030. That informs the institution of the Universal Health Coverage Program. Nigeria is one of the nations that have warmed up to the good idea. To achieve it, the government is battling to make effective the National Health Insurance Scheme. The scheme, popularly referred to as NHIS, covers a family of 6 with 4 children below the age of 18. Other family members who are students or out of school are registered as dependents. Following the specifications of the scheme, an employer is to contribute 10% of the basic salary of an employee, while the employee contributes 5% for the subsidization of drugs. The need for the government and the people to make the scheme active is what brought medical professionals together here at the 50th anniversary of St. Nicholas Hospital, Lagos. To make the National Health Insurance Scheme effective, experts say medical facilities must be expanded and upgraded. More health professionals must be employed, and more students can be encouraged to read medical courses through the provision of incentives like scholarships. Nigeria is the 7th largest country in the world, the 6th largest oil producer, boasting of an economy stronger than that of South Africa. But a rich country with sickly people will contradict reality. The reason why universal health coverage advocates are calling for the empowerment and total embrace of the National Health Insurance Scheme in Nigeria. Jacqueline Ogo, TVC News, Lagos.
Joining me now is the CEO, Occupational Health and Safety Management, Ehi Eden. It's nice to have you join me in the studio.
It feels so good to be
here. Very
good.
All right, now, 2030 target of meeting universal health coverage. I wonder how realistic from where we are right now.
I think it's just an ambition as far as Nigeria is concerned.
Someone would say there's nothing wrong in having ambitions.
Ambition is good, it's okay to have an ambition, but this is bogus. We are not making any move to actually achieve that. It's good to achieve those global concepts and global campaign, but we need to see what the government of the day is doing to achieve that. And look at the NHIS coverage take that as an example. I mean, a country of almost 200 million people, we have less than 5% of the population covered. And you want to achieve that? And even the NHIS that was supposed to have 3 arms, looking at even the informal and even the disabled population within society, there's even nothing for them. And look at even what is covered, just a minute percentage of the public sector. What about the state? So I think it just is an ambition. I don't think we have seen such body language from the government to achieve this.
When we even talk about health coverage, universal health coverage, what does it mean? What scenarios portray or show that someone is covered?
You see, it is a human right to actually have unlimited access to healthcare. It's one of the basic human rights. And for every man, every nation to be productive, you need a healthy population. And how do you get a healthy population when your population you have is not covered? And this is one of the key in this. So any out-of-pocket expenses is being thrown out of the entire scenario because it's not the best to actually fund healthcare. A man that is sick, critically ill, shouldn't wait to be looking for how to access funds from his colleagues or go to bank to be able to actually go to the hospital. And prepaid medical system has become the order of that. Everybody believes this can go a long way in covering healthcare system, but it has worked in many countries. But in Nigeria, it's a problem. If you look at what's allotted from Nigerian GDP to fund healthcare in Nigeria, it's less than 1%. Then you have countries like South Africa doing up to 7.5%. What is the healthcare budget that we have in Nigeria? It's on the average of 4%. But when you look at put all these things together, you find out that there has not also been the strong political will to work in line with this coverage, because most time we adopt it, we talk about it, but to actually domesticate it and put policies and processes in place in achieving this, our government always going to slumber.
Now, does it rest only on the government to have that achievement?
Not at all.
Okay.
Because when you talk of healthcare in Nigeria, it's a combination of two forces, the private and the public sector.
Right.
But you agree with me that now, as of today, the private sectors are the one that drive the healthcare system in Nigeria. People get sick. Nobody wants to go to the public hospital because you need to first place value on your people, because the treatment there is abysmal. People go to that place. When you don't have trust in the healthcare system, definitely that's already impacts on the treatment outcome, because medicine is sometimes based on psychology. I have to be sure of what you're doing to me, and for me to actually have quick enough recovery. But when it's totally broken down like we have today and nobody cares. I give you an example. Look at cancer in Nigeria right now. I was speaking to some oncologists recently. Cancer is a big game in Nigeria. But do you know that most times some teaching hospitals have to put people in buses to go and look for a center that is functional, that is functional machine? We can't continue like this and agree that we'll go meet this coverage.
All right.
It's not possible.
If we have to take the steps now towards achieving this, what will those steps be?
The first step we should take right now is to go back to that act that set up NHIS.
Okay.
Because NHIS, that is what we're looking at right now. The act on its own from inception was resting a very wrong pillar. And what's that pillar? You did not make it compulsory. So when you make it what is voluntary,
when it's optional.
Optional, people will not. Yeah, but when it was if it were compulsory, there's no employer of labor. There is no state government that will not buy into this. Now you find out that even what we have right now is that 5%, they are basically public sector. But what about the people that live in the community, rural areas where there are no public services in those places? How are they covered? So the first thing we should be doing is, let's go back to that act. Let's repeal it.
All right.
No longer optional, but should be compulsory and mandatory for every employer of labor.
All right. So we start from the policy and then to other.
Why are we still having a few number of Nigerians, being able to access this health scheme?
The question we should ask is how many Nigerians know about the health scheme? Okay. When you bring in a policy, I think one of the ways we should actually go about this policy is to first start by selling the policy to the public. There is no awareness in this direction of what NHIS represents. People don't even know about it. So it wasn't well sold to the public, because you have a policy that you brought in 2005. People were not engaged. And that's why you see people, they don't really understand how it works. You see people coming in and going out and coming in again. So people going out and coming in and going out again. So we need to first create awareness around the policy. People want to know what is in it for me.
So are you saying that we're having an underutilization of the scheme? So there's more we can do with the NHIS beyond the employer-employee? Tell us more in that regard.
Look we have the critical mass amongst even the low and medium income people and even the community people. Why are we not having what we call community health insurance? Why are we focusing on just insuring the public sector and leaving the critical mass behind? It's not stereotype. Let's create awareness amongst where we have the critical figures. We're talking about the community dwellers. This is what we have. How
will this community scheme work if we can have that on board?
One of the ways is to actually, let's unbundle the market.
Okay.
Do you understand? Why is it that it must be NHIS, must be? Let's have those key players are HMOs who play within the formal sector. Let's have some HMOs whose functions are within those informal sector and the community sector.
Right. And
that can go a long way, because even with the 5% that we have subscribed right now, even the HMOs can't even manage it properly. In Netherlands and other countries you have, it's segmented. This is your role.
Group addresses
exactly.
this population.
With that, you can have a group that you can hold accountable.
So how do we clean up the system again? Talking about unhealthy practices, many people complain about their HMOs and having connivance allegedly with the scheme. How do we clean up?
You remember the corruption that was in the system some time ago? I was here with you, Mike, to talk about this, where so much money was paid out, up to 4 billion or beyond, or 40 billion paid out by NHIS, and they were still owing hospitals. The truth is, let's have transparency in the system. One of the ways we can actually do that is NHIS, they are the regulator, they are also the operator. Let's ensure that funds are paid out and people who those funds are held in trust of are able to access funds. You go to hospital today, because that's where you look at it from. People are not able to go to hospital because when I go there, I'm not even attended to. Why must I be a second-class patient in a hospital because I'm under the NHIS or the HMO?
Okay, let's rest on this point now. Clean up the system, make it transparent. Ahid, and thank you so much for your contributions.
My pleasure.